Yes, and so maybe that's the way I'm going to start since it's 8 o'clock. Welcome everyone, and if you aren't making a comment that you'd like everyone to hear, please mute your microphones while we're listening to our speaker this morning. And I'd like to start by welcoming Dr. McPherson, who is the keynote speaker for Grand Rounds today. And Grand Rounds today is the start of our Pediatric Global Health Summit, which you see up on the screen here. So I want to thank Jason and his team for putting a wonderful symposium together. Just a couple of comments before I turn it over to Jason to introduce both the morning and the symposium. I'd like to again give a shout out to all of those who celebrated 5-year anniversaries for Ether Day last Friday. It was great to see all of you virtually. And a special shout out to Dr. John Truman, who celebrated his 60th year at the MGH. Congratulations again, John. Two things I'd like to urge everyone on this virtual event to do. One, please get your flu shot, and two, please vote. Do it. Then the last thing I'd like to mention is that we started with COVID updates last week. We're going to try to do that every other week, and so this will be a COVID-free Grand Rounds this morning. At least we won't talk about it formally. And so with that, again, thanks to Dr. McPherson, and I'll turn it over to Jason.
Well, thanks. Good morning, everybody, and welcome to our second Mass General Hospital for Children Global Health Summit. I'm really excited to hear Dr. McPherson's Grand Rounds today, but also want to make a couple of quick announcements. First, I want to thank everybody in advance, all our participants and many colleagues across MGH who helped organize this event, especially Fiona Danaher, who will introduce Dr. McPherson in a minute. Also want to thank Dr. Heather Komzinski and her family for their ongoing support of this meeting. Today's talk, I should point out, by Dr. McPherson will be recorded by a documentary filmmaker. So I just want to ask anybody who does not want to be filmed to please turn off their camera. The theme of this year's summit is on the impact of human migration on child health. And to be sure, people migrate for many, many reasons, but there are over 20 million children globally who've been displaced by extreme poverty, conflict, or violence. And whatever your background, you've undoubtedly crossed paths with some of these children, maybe many of these children, impacted by these societal forces or traumatic migration. And how we care for children in this position says everything about us and what our future holds. And for that reason, I hope we can use this meeting to learn from each other's experience and each other's commitment to helping the most vulnerable members of our community. So with that, I'd like to turn it over to Fiona.
Hey, good morning, everyone. Thank you so much for being here. I have the tremendous honor this morning of welcoming Dr. Pamela McPherson to open this year's Pediatric Global Health Summit with what promises to be a truly inspiring Grand Rounds. Dr. McPherson, who is an associate professor at Louisiana State University Health Shreveport and is triple boarded in general, child and adolescent, and forensic psychiatry, has dedicated her career to researching and addressing conditions of confinement and mental health impacts for children in the juvenile justice system. Along the way, she has emerged as a leading advocate for the rights and dignity of migrant children. Starting in 2014, Dr. McPherson contracted as a mental health subject matter expert with the Department of Homeland Security's Office of Civil Rights and Civil Liberties, conducting 10 investigations of ICE family detention facilities. Disturbed by the conditions she witnessed and the current administration's efforts to increase family detention, she joined her colleague Dr. Scott Allen in becoming a whistleblower in 2018, publicly denouncing family detention as inherently harmful to children and calling upon Congress to act. They wrote, "We have a professional duty not only to intervene to prevent physical and mental harm to children, but to speak out against assaults on their dignity as well. We also have a professional duty to speak out against injustice where authority discriminates against vulnerable populations, especially when it involves children. To remain silent would mean complicity. 14 leading medical professional associations immediately echoed their call for action. For her bravery in speaking out, Dr. McPherson has been honored by Physicians for Human Rights and awarded the Ridenhour Prize for Truth-Telling and an American Psychiatric Association Profile of Courage Award. As Jason mentioned, she's also being featured in an upcoming documentary for which a documentary filmmaker has joined us today to record this session. We therefore ask that all attendees make sure to mute yourselves and turn off your video cameras to avoid making any inadvertent cameos in the documentary. We welcome any questions for Dr. McPherson in the chat. We're incredibly grateful to Dr. McPherson for joining us today to share her experience and expertise. Welcome, Dr. McPherson.
Thank you so much for that kind introduction, and thank you to everyone who's worked so diligently to put together this wonderful conference. Good morning from Louisiana, and thank you all for joining me at the Pediatric Global Health Summit Grand Rounds presentation. It's a privilege to join you for the incredible events that are going to be hosted by the Pediatric Global Health Summit team over the next 2 days. But it's a true joy to me to connect with so many who seek to better the lives of children, because you are my tribe, and your presence renews me for the fight to better the world for children through healthcare. Our why is children, and our how is healthcare. Over the next 45 minutes, we will dig deeper into the why and the how of advocating for children's health and well-being. Through the centuries and today, in our principles of medical ethics, physicians are admonished to recognize our responsibility to seek changes in those requirements which are not in the best interests of our patients. When we seek changes, we become advocates. The day-to-day practice of medicine requires that we advocate for children in many ways. Prior authorizations, insurance appeals, addressing healthcare disparities. These are some of the ways we advocate, and the list goes on and on. These are things that you and I do daily. But in 2018, I found myself acting as an advocate on an entirely different level. I became a whistleblower, and that is the story that I will share with you this morning. As a child and adolescent psychiatrist, I have asked thousands of children, what do you want to be when you grow up? Not one has ever said, when I grow up, I want to be a whistleblower. I've never come across a medical school or residency applicant aspiring to be a whistleblower. No one seeks the role of a whistleblower. It requires a skill set not taught in medical school. It may be thrust upon you when you least expect it and already have a full and busy life. It's a step that changes your life in ways you cannot begin to imagine. Becoming a whistleblower creates added burdens, but it eases the greater burden of silence. I certainly never thought I would become a whistleblower, but my why and my how, years of advocating for children's health and well-being, brought me to that moment where the burden of silence was greater than the risk of the unknown. As that burden became crushing, I took action. Never in my wildest dreams did I expect to write to Congress or be quoted in the New York Times. I never expected to find myself in a room with the award-winning journalist Scott Pelley, let alone that I would be the one fielding his questions on 60 Minutes. But in 2018, I was under the lights and cameras in front of 10 million viewers with my fellow whistleblower, Dr. Allen. Our attorney was close by, monitoring our every word as we called out the injustices of family separation and family detention. Giving voice to my personal experience and the outrage of the world was surreal and nerve-wracking experience. but knowing my why and my how allowed me to step up and hold the course. Like you, what energizes me, my why, is helping children to have healthy lives. I was fortunate to find my why at a very young age, but it started with a great disappointment. Just before I started third grade, we moved from a place where I felt comfortable and was surrounded by my extended family to Illinois. My adjustment was rocky. I was told that I talked funny, and my parents were told that I would never really read well. All the changes didn't seem fair, and I longed to fit in. And I landed on a solution. My 8-year-old self wanted nothing more than this pair of boots. Have you ever known in your heart that one thing could fulfill all your dreams, catapult you to that higher level of being? Well, for me, it was these boots. As an 8-year-old, as an eighth grader, as a third grader living in subsidized graduate student apartment, I wanted to be like the girls who lived in houses and had cool clothes and those books. So I left not so subtle hints that all I wanted for Christmas were these boots. Little did my 8-year-old self know that my disappointment over not receiving those boots would lead me to my why. Those boots weren't in the cards for me, not just because money was tight. I didn't receive those boots because we would be moving again. My father's graduate research would be in Central America, and I wouldn't need boots in the tropics. Like many children this fall, I was homeschooled that year, and it was actually great. I loved that a full day's lessons could be completed in a few hours, but that didn't last long. My parents decided that after our lessons at home, we would attend the local school to be with other children and learn Spanish. As true children of the 60s, we protested, marching around the house with signs, proclaiming that a double school day just wasn't fair. Again, I didn't get my way. And that first day, I nervously climbed onto the local city bus and started a new school, my third in 3 years. The school was very different from my American school. I had to adapt to lots of new situations in a school where no one spoke English. We wore uniforms and stood as a sign of respect whenever an adult entered a room. We worked in a garden growing vegetables for our school lunch. And in science class, we learned about dental hygiene and started brushing our teeth at school each day. Many of my new friends had never brushed their teeth before. But the biggest change for me was that from day one, I was the girl that had it all. I was exotic. Everyone wanted to be my friend. One day on the playground, my new friends took this girl, Carmen, aside. They shouted at her and sent her away. With my limited Spanish, I wasn't sure what was going on, and I asked why, ¿por qué? I couldn't understand the rapidly worded reply, so a pantomime ensued. They pointed at her bare feet and said, pobre, poor. My friends had sent Carmen away because she was too poor to play with me. I said, juegamos todas juntas, let's all play together, and we did. In that moment, I realized that I wasn't really exotic. I was Carmen, and she was me. I was aware that I had not changed. My family's circumstances had not changed. It was the perception of others that had changed. There was tremendous power in that moment. I did not need to allow others to define me. I realized that I alone determined who I was and would become. It wasn't just school. Other things were different too. On trips to the city, I would see children younger than me working, selling newspapers or chiclets or offering to wash our car. I wondered where their parents were. It didn't seem fair that small children were working and that they weren't in school. I also saw many children who were sick. Families traveled from all over the country to bring their children to this, the National Children's Hospital. I saw children with open sores from leishmaniasis that had grown to deform their faces. Children in makeshift wheelchairs, unable to walk because of injury or birth defect. Children missing limbs, scooting about on boards with roller skate wheels. Why were adults allowing these children to suffer? I saw so much suffering in the world and so much that was unfair. To my parents' credit, they did not shelter me. We talked about what we saw and different ways to help others. These conversations helped me to accept that suffering exists in the world and gave me the strength to not look away or ignore what I saw. I knew my why would be to make the world a bit more fair for children. But how would I make the world better? At my college, the staircase of the science building had a quote inlaid on each floor. Almost every day for 4 years, I read this quote from Woodrow Wilson: "You are here to enrich the world." How would I enrich the world? My how I would make life better for children would be as a physician. But what would I do as a physician that would make a difference? My balance of caring for children and advocating for children has been the foundation of a very fulfilling career. Advocating for the health of justice-involved youth, and most recently immigrant children who were detained or separated from their parents, has enriched my life in many, many ways. And this is my advice to you. Nail down your why and your how and fully embrace it, and be prepared, because you never know where that calling may take you. I am a paid mental health subject matter expert for the United States Department of Homeland Security. Today, I'm not speaking as a representative of the Department of Homeland Security. The opinions expressed are my own. Immigration detention is a disturbing topic. I will be discussing trauma, which may be triggering for some, and images in this presentation may cause distress. I'm an adult and child and adolescent psychiatrist with additional training in forensic psychiatry. As a forensic psychiatrist, I use my knowledge of mental health to inform legal matters. In this capacity, I have been retained by attorneys, courts, states, and agencies such as the United States Department of Justice and the Department of Homeland Security to render opinions regarding mental health services for detained persons. In 2018, you may recall seeing images like this: children in cages with silver bright blankets and people sleeping on the floor. This is a Customs and Border Patrol facility. Over 800 bioethicists from around the world called the medical conditions at border facilities ethically abhorrent. In a letter to the Council for the Flores class, they called out the long-term risk of physical and mental health consequences for children held in these facilities. The bioethicist said, "These principles, respect for persons, avoidance of harm, and fair treatment, apply whenever individual and community health are at issue, as in this case, where the physical and mental health of detainees are being placed at extreme risk." But what of the family residential centers, the facilities I investigated? The facilities that a high-ranking ICE official called more like summer camp. I became a subject matter expert in 2014, tasked with identifying deficiencies in the family residential centers. Prior to that time, I had read the occasional article about about immigration detention, but I never really dug much deeper. My work in juvenile justice facilities provided an almost infinite opportunity for advocacy. It was because of my experience with juvenile justice that I was asked to join the team investigating the family residential centers. While the family residential centers look different from the border facilities, the risks to children remain a concern. Over the past 6 years, I have investigated complaints about the mental health care provided at the family residential centers, first in Artesia, New Mexico, and later at Berks in Pennsylvania, and at the facilities in Dilley and Karnes City, Texas. I recall seeing these strollers lined up at Dilley and thinking that these empty strollers outside the cafeteria represented infants and toddlers. Infants and toddlers who we as Americans were rounding up and incarcerating while their families filed for asylum, a completely legal process. I asked myself, what kind of country incarcerates infants and toddlers? It offended and saddened me on a visceral level. It struck me how unfairly we were treating children. As a civil rights and civil liberties subject matter expert, I understood that no one cared what I thought was fair or unfair. As a forensic psychiatrist, the intersection of mental health and justice was my domain and where I had a voice. Compliance with policies and procedures was what I had been asked to investigate, and I notified CRCL of specific deficiencies that I found in the family residential standards. As a subject matter expert, my job was to identify deficiencies and recommend remedies. But as a physician, my ethics provided me a more encompassing mandate. As healthcare providers, we have an ethical duty to alert management when imminent harm is foreseeable due to deficiencies in policies or practices. It is when management has been warned and fails to take action that an ethical dilemma may arise and even lead to moral distress or injury. As a mental health subject matter expert, I informed CRCL and the Department of Homeland Security of the deficiencies I found. These deficiencies supported the closure of the Artesia, New Mexico facility, which occurred a few months after our reports were issued. Our recommendations also called for the creation of an advisory committee on the family residential centers. In 2016, that Federal Advisory Committee on the Family Residential Centers released a 166-page report that detailed recommendations, including mental health recommendations that echoed my own advice to CRCL. The committee advised the detention or the separation of families for the purposes of immigration enforcement or management are never in the best interest of children. The American Academy of Pediatrics policy on the detention of immigrant children, authored by Dr. Julie Linton and others, was published a year later, calling on pediatricians to protect the health and well-being of immigrant children and calling on the Department of Homeland Security to discontinue the use of family detention. The fundamental unfairness of immigrant detention remained, but advocacy through established channels has been moving the needle. That changed in the spring of 2018, the spring that the United States of America inflicted the policy of mass separation on immigrating families. Along with you, I saw the images, including this iconic award-winning photo by John Moore. Of this image, he said, "I could see the fear on their faces and in their eyes. For me, it was a chance to show a view of humanity that is often only related in statistics." The world recognized the inhumanity of this injustice. His image galvanized the world. As protests erupted across the world, I asked myself, what part am I playing in this? What should I do? What can I do? You may have asked yourself, what can I do? When you saw the images of children being separated from their parents at the border. Many have told me that they were devastated by the images and felt angry, but also experienced a profound sense of helplessness. I could barely contain my outrage. After all, I'm a child and adolescent psychiatrist. I'm a medical doctor who specializes in helping children struggling with overcoming emotions. I help children and families to be stronger. As a child and adolescent psychiatrist, I know that families are vital to healthy development and that separating children from their parents can cause profound trauma. When I heard of children being separated from their parents, I thought of children crying for their mothers and fathers with no one to comfort them. Later, I learned the situation was much more devastating than I had imagined. I met Dr. Colleen Kraft, who is president of the American Academy of Pediatrics, had visited the so-called tender age facilities that held the children separated from their parents. Dr. Kraft described entering a room of toddlers. The room was silent. No playing, no interacting, a room of silent stares. There was no mistaking this behavior. These children were traumatized. They had likely cried and cried, called out for their parents, and finally they just gave up. They gave up on anyone answering their cries. This type of traumatic stress can cause children to suffer serious regression, the loss of developmental milestones. They can develop difficulties controlling their emotions and an impaired ability to form healthy relationships. Trauma can lead to difficulties differentiating safe and unsafe situations. So a child who has experienced a traumatic separation may feel unsafe when a parent leaves the home for a simple shopping trip, and the child may become inconsolable. Or the child may refuse to go to school because separation feels so unsafe. Older children may take on adult responsibilities and behaviors too soon. There is no doubt that a child's relationship with a parent and community, the sense of attachment and belonging fostered by being a member of a family, school, faith community, and the larger community, are necessary for healthy development and to protect the children from the effects of trauma. As I saw these images, I felt moral distress. I knew children were being harmed and that I should act, but I didn't know what to do. This was my call to action. My distress was compounded by reports that the administration was planning to rapidly expand family detention 5-fold and hold families indefinitely. My experience as a subject matter expert made it crystal clear that rapidly thrown together family residential centers would place children at imminent risk of harm. I had trouble sleeping and thought about my role with the Department of Homeland Security throughout the day. I considered resigning. Then I got a call. Dr. Scott Allen called me. Dr. Allen is a CRCL medical subject matter expert. We had investigated the family residential centers together, and Dr. Allen was feeling the same outrage that you and I were feeling, but he brought some skills to the table. He was a skilled advocate on multiple levels, and he had experience writing op-eds and knew the ins and outs of medical organizations and legislative advocacy. He asked me to join him in writing an op-ed. We discussed our goals and our ethical obligations. We knew that the expansion of family detention, locking up even more families, and exceeding the 20 days that was allowed by the Flores Agreement was dangerous. We had been inside those facilities. We knew that facilities thrown together quickly would fail to meet standards. We knew that locking children up indefinitely would place children at serious risk of harm. Now we spent any free time organizing our thoughts and writing. We had long phone conversations discussing our options. As we considered contacting journalists, we received some very important advice, maybe the most important advice of my entire life. We were told, before you publish anything, find a good attorney. After some research, we contacted the Government Accountability Project. The same team now representing Dawn Wooten, the nurse blowing the whistle on ICE for performing hysterectomies on detained women without consent. Legal representation was important because we had signed non-disclosure agreements with the Department of Homeland Security. We didn't know what the blowback might be if we disclosed information from our investigations. We were fortunate that the Government Accountability Project agreed to represent us. Our attorney helped us to understand our rights. We learned how to make our voices heard legally. We would have made serious mistakes without legal representation. Since 1977, the Government Accountability Project has represented whistleblowers, thousands of us. They are the experts in this specialized area of the law. Since the earliest days of our country, in 1778, shortly after the Declaration of Independence was signed, the Continental Congress enacted a resolution stating, "It is the duty of all persons in the service of the United States, as well as all other inhabitants thereof, to give the earliest information to Congress of any misconduct which may come to their knowledge." In 1777, the original American whistleblowers acted to expose the mistreatment of prisoners. They were sailors who sent a petition to the Continental Congress exposing the commander of the Continental Navy, Commodore Hopkins, who they said treated prisoners in the most inhuman and barbarous manner. Not only did the Congress enact the resolution, they paid the fees of the sailors when the Commodore sued them for libel. The sailors were victorious in their suit. Even with laws protecting whistleblowers, sometimes whistleblowers lose their jobs or may be investigated or arrested. At the time, as I considered blowing the whistle, my greatest concern was protecting my license. I loved my work as a child and adolescent psychiatrist, and I'm needed in my community. But I worked with some people who did not share my concern about the separation of children. I work at a state-supported mental health center in a very red state. A child psychiatrist that I admired explained to our fellows why family separation was necessary and good. Would my colleagues see my actions as political and a violation of my professional and state ethics. During this emotional time, I struggled to remain objective. During the process of considering the human rights of migrating families, my own complicity in family detention, and my responsibility to advocate for care, I recalled that the American Academy of Psychiatry and Law requires forensic psychiatrists to act with honesty and objectivity. Striving for objectivity required me to examine my biases. While no one can ever be completely free of bias, I knew that I had to limit my opinions to my area of competence. Statements of professional ethics warn us to avoid acting outside our area of competence. For me, this meant restricting my comments to the provision of mental health care. After all, I'm not an expert on public policy or politics. Clearly defining my goals and the ethical issues was necessary before I could take action. Instead of an op-ed, Dr. Allen and I began putting our concerns into a letter that would travel up the chain of command from CRCL to the Department of Homeland Security to the Office of the Inspector General and ultimately the United States Congress. At the same time, we had limited discussions with families, colleagues, and others who might be impacted by our decision. Remember, I was a subcontractor. I didn't know if my actions would have consequences for the other mental health subject matter experts. In Louisiana, I worked for the state. I didn't know how colleagues would view my actions. I was advised by some to keep quiet because my actions wouldn't make a difference and might cause me problems. After weeks of turmoil over family separation and the expansion of family detention and a few days of considering my options, I decided to become a whistleblower. After making that decision, I slept well for the first night in a long time. The moral distress of knowing that action was necessary was resolved when I acted. The sadness and anger I felt fueled my action, but it was tempered with reason and careful planning. Within days of delivering our letter to Congress, we received a call from our attorney that it had been published in the New York Times. With our disclosures now in the press, we wondered if our colleagues and professional medical organizations would respond, and if they did, what would they say? Would professional medical organizations agree with our analysis that we had a professional ethical obligation to act? Recalling my moral distress in the summer of 2018, while I acted with legal guidance, I didn't know if professional organizations and colleagues would support my decision to step outside my relationship with the Department of Homeland Security and to notify Congress of my concerns. Because of the legality involved, my discussions with others, even my family, were limited.
I have a conference call.
I could imagine what the values of other stakeholders might be, but for legal reasons, I could not have those discussions. I could not consult with committees or organizations specializing in bioethics, or even share all details with my family. While I was at peace with my actions, I was not without anxiety. Within weeks of the disclosure to Congress, 14 professional, medical, and mental health organizations supported our letter to Congress and our ethical obligation to alert Congress. The 14 organizations supported us and called for congressional inquiry and oversight of family detention in their own letter to Congress. Many professional organizations, including the American Psychiatric Association, the American Academy of Child and Adolescent Psychiatry, and the American Academy of Pediatrics, have voiced opposition to the detention of families. Dr. Alpha Stewart, then president of the APA, wrote to me, thanking me for my moral courage. While these voices have been affirming, It was my recognition of my own responsibility and my decision to take action that calmed my moral distress. My action spurred others to action. My favorite was a letter from an 8-year-old girl named Eva Kate. After she watched the 60 Minutes interview of Dr. Allen and me, she wrote to the president. Her mother posted Eva's letter to the president on social media. In her letter, Eva said, "Separating families is wrong, like when you put the kids in cages." I posted a thank you to Eva for writing her letter, and later we met for lunch. I was reminded that our children are always watching and listening. When we use our voice, we give them hope and teach them that change is possible if we take action. This summer, the summer that the world was fighting the pandemic, we learned that family separation was happening again. Because of the risk of COVID-19 in detention, Judge Gee ordered that children be released from family detention centers, but her authority did not extend to releasing parents. We heard that rather than releasing families, parents were being offered the Sophie's choice of sign over your parental rights and your children can be released, or keep them with you in detention and risk infecting them. Again, we became whistleblowers. I am still a mental health subject matter expert for CRCL, and I still ask myself if working for CRCL is the right thing to do. Am I making a difference? At what point does acting as a subject matter expert for CRCL become unethical? While family detention remains, and I do know that my advocacy has made a difference, I still wrestle with those questions. But this I do know, we must not look away. We must see the horrors inflicted on children and not become mired in that moment. We must strive for a world that allows each child to be whole. I was extremely privileged and lucky to find my why and my how at an early age. I have used my how in recent years in ways that I never thought possible. All of us have a why and a how in us. It's just a matter of when we use it and how we use it. Not everyone will be a whistleblower, but all of us can and do make a difference. And I will leave you with one last thought. Granito. During the roller coaster ride that has been my whistleblower journey, I met the filmmaker Pamela Yates. For over 30 years, she has chronicled the injustice that has led so many to leave their homes and seek asylum in the United States. From her films, I learned the philosophy of granito. Granito de arena means grain of sand, and granito is the Mayan philosophy of collective change, collective impact. The idea that we each contribute to social change, and we can only tackle complex social issues together. Our daily acts of kindness, our advocacy efforts, big and small, are the grains of sand that contribute to change. I no longer dwell on what is unfair. I know my why and my how fuel actions that, combined with yours, will have a collective impact leading to change. It is my hope that you will remember that knowing your why and how leads to actions that make a difference. Please join me in waking each day and asking, how can I enrich the life of a child? And when you rest each night, know that your grains of sand have mattered. Thank you so much for joining me, and please enjoy the Pediatric Global Health Summit.
Dr. McPherson, thank you so much for that amazing presentation. I'm receiving private messages from people saying, please, can we all unmute and give you a standing ovation? I think that would be mass chaos, but please know that the sentiment is there. I'd encourage everyone to put their questions for Dr. McPherson into the chat. We haven't had any yet, so I will start off. You mentioned the need to examine your own biases and to really try to stick to your expertise as a mental health clinician. And I'm curious how you thread that needle when dealing with something so, I think, inherently morally reprehensible to so many people. It's a very difficult thing to approach objectively. And I'm curious for your thoughts on how to approach that.
You're so right about that, Dr. Danner. My forensic training, working in prisons and jails, working in juvenile justice facilities, was something that has allowed me over time to separate my emotions to a degree. The family residential centers weren't the first institutions I visited that had conditions of confinement that were abhorrent to children. In my own state of Louisiana, I can recall visiting, investigating a juvenile facility with a young man in a wheelchair who had compression ulcers. His bottom was, literally rotting because he was not receiving proper care. At that time, early in my career, it was much more difficult to thread the needle. Having had so many experiences, even those, I mentioned as a child, where children were were not receiving the care that they received, but not looking away, feeling the emotions, working through the emotions, allows me to separate emotion and bias. Giving myself time to do that is very critical. And I would highlight that for everyone, that this work is done in small steps, not great leaps. And the small steps require, watching where you put your foot each step of the way. When we're dealing with the law, as physicians, we're out of our realm. In our clinics, in our offices, we are the masters of what we're doing. But when we step into courtrooms or into the legal realm, we're dealing with a different realm, and we have to take small steps in order to avoid missteps. I've also had many wonderful mentors, and I've read the works that some of you have written, and those things have helped me to focus on the critical aspects of my work, where I have expertise, rather than the emotions that are always there.
Thank you. We received a question in the chat about whether you've experienced any sort of retribution for speaking out.
I am very fortunate. I've not received any type of retribution. I continue to work as a subject matter for the Department of Homeland Security. The team that I work with has been supportive of me. The reason I believe that I've not suffered any type of blowback is that we were so careful. The Government Accountability Project spent countless hours with us explaining whistleblower laws, taking procedures step by step so that we would be protected by whistleblower laws. I think the biggest blowback was probably that I heard that there was a tweet after 60 minutes, but nothing further.
Thank you. We received another question. What types of education outreach do you do directly to children, not detained children, but children like Eva Kate? Are schools teaching children about what's going on with other kids that in some cases are just down the block from them at local detention centers?
We are extremely fortunate where I live in Northwest Louisiana that our community foundation and our juvenile justice complex fully embraces adverse childhood experiences, fully embraces ACEs. All of our juvenile justice staff have had ACEs training, and we have trained all teachers in Northwest Louisiana. This training in ACEs and helping teachers to implement the adverse childhood experiences principles to recognize trauma first of all, and then know how to talk to children has been just an amazing experience. And it's been very gratifying to be an ACEs trainer for professionals in our area.
Great. One of the comments that you made in an earlier answer to a question stood out to me. I was curious as you described the response, or listening to one of your colleagues tell fellows and residents that family separation was not a bad thing, how you would advise people to respond to colleagues who may say things like these. I think that in the current climate, with more awareness of issues around racial justice, people are looking for ways to engage better as bystanders. And one of the things we need to do is to learn how to hold each other to account in professional settings. So I'm curious if you have advice on that.
One of the things that my forensic colleagues and I have worked very hard to do here is to have civil conversations about our differences. I believe that meeting with people who you don't necessarily agree with and understanding their point of view gives you an opportunity to strengthen your own point of view. So having those discussions, understanding what concerns or fears may underlie a statement, such as the one my colleague made, allow me to sharpen my own point of view. And I guess that's the way I look at it. Being a Democrat married to a Republican, I've had many, many opportunities to sharpen my point of view on a variety of topics. As my husband and I debated before our children as they were growing up. I was glad that I had the opportunity to talk with our residents and fellows about my point of view. So that they heard both sides. They could make their own decisions, but having civil conversations when we disagree, speaking to the facts and not using straw man arguments or belittling others, I think is a very important professional responsibility.
Another question I've just received: how successful have efforts been to promote alternatives to detention and to really move towards decarceration?
Prior to the election, we were hopeful that family detention would be downsized and perhaps eliminated. But of course, as we saw after the election, our hopes for that evaporated. I would echo Dr. Kleinman in saying vote.
Okay. A question from Dr. Jim Perrin. How can we think about planning to welcome families whole, integrating them in welcoming communities, offering gainful employment and basic housing, food, and clothing? Essentially, what would be your recommendations for welcoming these families as opposed to the current system?
That's a very broad question, certainly far beyond my expertise. But I would say that as physicians, we all have to recognize that we come in contact with these families. They come into our offices for medical or mental health care, and we have to be prepared to provide them with the resources to assist them. We also should work with media in our own communities, particularly those media outlets that would be most accessible to immigrant families, to let them know about the services in our community and how to safely access services.
Great. One last question, and I think we'll wrap up because the next session begins at 9 o'clock. We know that even though family separation officially ended on paper in 2018, and as you mentioned, there have been issues with redux in ICE family detention of encouraging families to separate. We also know that family separations continue at the border under the guise of for-cause separations, which usually are not for great causes. The question that we received is, based on your past and current knowledge, do you have concerns that there may be a family separation 3.0 coming down the line? What do you think this may look like in the future?
I'm not sure what it may look like in the future. I do know that for the rest of my life, for the rest of all of our lives, we will be confronting the fallout. We will be seeing children who have suffered at the hands of these policies. And it's up to us to make them whole and to help them.
Fiona, if I could just say one perhaps last thing. First, I want to thank Dr. McPherson for really an absolutely inspiring hour. We truly appreciate what you've taught us today and are very grateful that you've taken the time to be with us. I think as I think about this, I think about what matters most. And as sickening as child separation has been, what's maddening is that it's been done in my name. I am a citizen of the United States, and these are actions that have been carried out because of actions that I've taken or not taken over the past 4 or 5 years. So I want to simply ask all of you on this call to decide what matters most to you and what you're going to allow to continue to be done in your names. And then follow the path that Dr. McPherson has outlined for us today, and how you can take actions both small and large to make change occur. And vote. Definitely vote, and make sure that your vote gets to the people who are going to count it. And with that, I again want to thank you, Dr. McPherson, Fiona, Jason, and all of the organizers of the Pediatric Global Health Symposium for a wonderful start. Thank you.
There's lots of muted clapping occurring. Thank you again, Dr. McPherson. We're so grateful to you for being here and for all of the things that you've done for the children in your care. It is 9 o'clock, and we have a full morning of activities for the Global Health Symposium. The next session is a panel on child trafficking, which will be moderated by Dr. Wendy Macias-Constantopoulos. We have an amazing lineup of panelists, so I'd encourage everybody to join. Everybody who registered should have received the link, and maybe Amu would be able to post a link in the chat if anybody who did not register would like to hop over and join that talk. Thank you all again.